Good evening, everyone, and welcome to session 6 of the Master Trainer Program, batch 17. So, today's topic of discussion is very important, and I think we all handle this day in, day out. But this session will empower us with the understanding of how do we really handle difficult situations in a more professional and responsible way, because that's where the patient satisfaction primarily lies. And the topic of discussion is how do you go about handling uncooperative patients. So rather than calling uncooperative patients, I'll say difficult situations where maybe we and the patient party is not on the same page, or we are not able to understand each other's perspective. So, what is your understanding of uncooperative patients? So, whom would you call patients who are not cooperative or who are not understanding?
May I?
Yeah, go ahead, Shikha.
Uncooperative patients might be who don't listen about the treatment protocols, who don't listen the emergency condition of the patient. They think that doctors are just taking everything for granted and they are just making money. So they refuse everything and they are not cooperative and not thinking about the patient condition. They think about the financial issues. So most of the times, this financial issues is the most important barrier, and that makes the family members uncooperative during the treatment protocol.
Okay. I think one of the situation very commonly we see is when we want the patient to be, retained either put in the ICU or put on a ventilator, but sometimes they are not able to understand the importance and relevance, and they assume that probably we are doing it to make money, and then they become uncooperative. Thank you, Shika. I think that's a very common situation we all face.
Ma'am.
What about others? Yeah,
Mitu. So, ma'am, it's an incident of today morning only. What happened? I got a call from one of my friend that the doctor is unnecessary putting my patient into ICU. And now the uncooperative part was that the patient was not having oral medicine in the ward, and he was landing up into with pH 7.4, and the CO2 levels were rising, and patient of hepatic encephalopathy, and he was totally deranged. Now here, the patient was uncooperative because of his the kind of disease he has.
Medical condition.
The medical condition. So that is also uncooperative, where he doesn't know what he has to do right, but he turns into an uncooperative patient.
Absolutely. I think that I agree. A lot of time when the patient does not have insight or because of the medical condition, the patient is not, responding appropriately. So it becomes again a situation where we need to really handle very meticulously, very carefully. Thank you for sharing that. Anybody else who would like to share their understanding?
It could be maybe even lack of time to process the information that has been given to them. So hence, not going to cooperate. It could also be education levels where there's been use of too many terminologies, which obviously your comprehension gets affected.
So I think probably what you're talking about is the causes or the reason why sometimes people become uncooperative. And I think you're very right. Language can be a problem. Understanding can be a problem. The way we have explained could be a problem, or time that one requires to process the information is not enough. So they become jittery and they start, behaving uncooperative. Absolutely true. Maheshwari, what is your point of view on this? So I'm sure you are in hospital and you must be coming across a lot of situations.
The financial issues comes the primary concern with the patients, ma'am, and the age of the patient. If the patient is like old enough and they were not ready to take further treatment, also they hesitate.
Yeah, sometimes they think that there's no need for this treatment and we can take the patient home and look after. Or maybe sometimes they refuse for surgery or a procedure or something that is expensive in terms of their financial this thing. So maybe they would not want. I agree. Yes, Arshia, what is your understanding of when we say patient is uncooperative?
I think lack of cooperation usually occurs due to lack of trust from the patients. So it could be as simple as the diagnosis that has been given by one doctor. If it is a serious diagnosis, and that feeling that okay, it's because probably they want to hospitalized, and because of that, sometimes they might not cooperate because they want a second opinion and go further and check before they can actually accept the condition.
Yeah.
So I think that's one of the reasons why.
I think yes, I think Gunjan, I want to hear from you also. Gunjan. Gunjan, you need to either unmute and speak, otherwise I'm going to remove you from the audience and then you will not be able to join back. Gunjan, are you there? Okay. There she goes. I don't want anybody, as dummy member either. You have to speak, participate, and discuss. So I completely agree with the situation that you have shared. A lot of time when we say the patient requires blood, so we want family to donate blood. We see that they're not ready to arrange blood. They are okay to pay, but they don't want to donate blood. Whereas we know it's important for people to donate blood because we can't buy it from the market. A lot of time, like for example, when we want to put the patient on ventilator or move the patient to ICU, they will not agree. Or if we say we need to move the patient to another hospital for some super specialized care, again, family may not agree, especially in the government sector. They are okay with something that is convenient to them, near to them. So, or relatives, coming into the ICU and, at their free will, not following the timings and the visiting hours. Sometimes a lot of patients, relatives will surround the patient and sit and talk and will not listen. I think these are very, very common situations we all come across. And we have to actually understand how do we go about handling it in a manner that ultimately the outcome comes out as desired, but everybody goes happy. They are looked after. So going further, I think we'll do a small role play. So I had shared a case study in the morning. I hope you got a chance to see in the group. Did you all see? Who all have not seen, please raise your hand. Maheshwari, you have not seen the case study? Okay. Rest, all of you have done it? Okay, great. So I gave a very, very simple situation, nothing very big. So this is a situation where there's like Maheshwari was telling, the patient is old. They're not willing to, pay or get the procedure done or, let the patient be there. So it's quite similar to it. There's a lady, 70 years old lady, and she requires foot amputation for diabetic infection. And then, but the family is not willing to, and they want to go Lama. They want to, maybe they want to try some other treatment. So who would be the patient's family? Who would like to be the patient's family? So I request all of you to now, come forward and participate in the role plays because that's what we are going to learn. Actual learning is through these role plays. So, and each one of you should play the role of a patient's attendant, or if the need be patient or the doctor. Even if you are not a medical professional, it's all right to go in that role because you will be able to understand the challenges doctors have when it comes to striking a conversation and explaining their point of view. So that also will help you empathize with their situation. That without training, how sometimes it is difficult to even discuss those complex issues and explain them. So I request all of you to happily, voluntarily come forward. Mitu has agreed to be patient's family. So we have, anybody else who would like to accompany her because we require 2 family members?
Me.
Okay, so Shikha, you be the patient's family with Mitu. So Michelle, can I request you to be the doctor? Okay, because I know you have been handling such situations, so I don't think you should have a problem. And then we'll set the ball rolling and everybody will turn by turn will become either patient or family member or the, just 1 second, there's a message from them. Okay. So do you want me to show the case study, or you all have seen it?
We have seen it.
You have seen it, yeah. So imagine that Gunjan is the doctor on duty, and Mitu, you and Shikha, you are patients, maybe daughters. Both of you are patients' daughters. And now you have come to Michelle saying that we want to take the patient Lamu. And let's see how, okay, Michelle, electricity failure?
Yes, ma'am. Just give it a minute or so. Sorry.
No problem. Will it be, I mean, resumed quickly, or?
Yeah, it should come back in seconds. Okay. I'm hoping it'll stay.
So, Mitu, in case if you're not able to have your camera on, it's all right. But if you can have it, there's nothing like it, because that will help us to.
I
You're
won't be able to act the scene, ma'am. So I want to come into
It's verbal. It's just verbal. You will have
Okay,
to
that's fine. That's fine.
if you're comfortable. If you're comfortable. Yeah. So what I want everybody else to see, we will all be switching off our video. Only three of them will have their video on. Michelle, Shikha, and Nitu. Three of them will have their video on. All of us will switch off the video. Now, what I want those who are observing, like Ashia, you, and Maheshwari, what we have to observe is that how Michelle tries to, strike the conversation. We have to look at the language, paralanguage, body language. All three things we have to closely observe. But we have to be also, we have to focus on the good points. Agenda is not to find fault with what she does, because she's also like, although she has understanding, but then it's not easy to come and do the role play extempo when you don't even know what it is doing. So we have to be, soft, gentle in talking about what could have been done, and focus on what she does well, because that's where our real learning lies. And then we'll have a discussion around. So Michelle, it's take it easy. No critical this thing
Sure.
about your role play, and we haven't done with that. We are just going to learn from what you do, and then we'll have a discussion around. Is that okay?
Yes.
So
Yes.
even I'm switching off my camera, and if I come back, that means either I want you to hold for a second, or maybe we are going to end it. So you think 2 to 3 minutes are enough?
Yeah.
Okay.
Yeah, ma'am.
Yeah. So I'm also going to switch off my video. And Mitu, if you are comfortable, you can have your video on, and we can do the discussion. Yes, go ahead, please.
Right. So good evening. My name is Michelle, and I'm the doctor managing Mrs. Sharma. Before we get started, can I get to know how you're related to Mrs. Sharma?
Oh, hi. We are daughters of Mrs. Sharma, me and Shikha.
Okay. Right.
Yeah.
So,
So,
yeah, go ahead. Sorry.
what we wanted to understand was like, how's the condition? Because we are not finding anything positive going on with the patient, and we're quite apprehensive about it.
Right. Yeah, I do understand that you coming here today and sitting in front of me tells me that there are a couple of things that we need to discuss. And definitely, this sounds like a distressing situation for the both of you. But before we get to the point of kind of coming and answering your questions, can you tell me a little bit of background of how your mom came into the hospital and what has happened back at home or where she was?
I think we gave everything in the history. It's been almost 5 days with her, and now you're asking me something about how she came. Is like, I don't know. I'm little upset. बाप कह रहे हैं पैर काट देंगे उनका, like it's something I'm not. It's very difficult, you know. This is what I want to.
She's 70 years.
Okay,
So,
right. So how do you think she
you
has
know
been,
about the history about our mother very well.
right? So can you give me a little bit of understanding how she has been doing here? I understand we talked about
Can I come in?
sorry.
So the agenda was that both of them have come to you saying that we want to take our mother home.
Right.
So,
Okay.
and if it is day 5, I think what we are discussing is assume that all this discussion has already happened.
Yeah.
What I want we all to focus on is that they are insisting on taking the patient home because they want to try some alternative treatment.
Right.
But you are trying to explain to them whatever you want to explain.
Okay.
Can we restart it?
Yeah.
Yeah, sure, ma'am.
Yes.
Right. So, good evening. My name is Michelle, and I understand we are here to talk about Mrs. Sharma. Um, can you just start by telling me a little bit about what is concerning you today?
We have
We wanted
already informed everything earlier, and we
Right.
just came to know about the complications that doctors want to discuss.
I
Right.
think Shikha, let's take her home. We know the alternative treatment. हम घर पे check करा के करा लेंगे. I
Doctor, we
think.
actually wanted because she's 70 years and she won't be able to stay in the hospital for long. So
Yeah.
let's take her Lama if you suggest, sister.
No. I think let's take her Lama. Let's not even Lama. Like we need to take her home and वो घर के बगल वाले वैद्य जी हैं, we'll show it to them. And I had a word with him. He said he's going to treat her, and nothing like. So let's just take her home. Dr. Michelle, if you can just help us, what are the formalities to be done?
Right. So I do understand that it's been 5 days and you are concerned that there's been no progress. And now, obviously, for us telling you that there's an infection and things are not getting better and needing to go in for surgery. What do you
But since
think that
past
this
five
other person,
days you have not done anything in progress. So now we
right?
are thinking about any alternative things.
Right. May I just ask, like, what is your mom wanting to do?
No. How
She's
would
not
she
a
know?
patient.
She cannot decide it on her own. If I go and tell her now, we want to take her. We are
We
very
just
clear. We
wanted
want to
to
take
be
her.
get
Yeah.
relaxed.
Okay. All right. And could I say that, I mean, are you both the primary decision makers now with her treatment?
Yes. We are the
We are
primary
her
decision.
daughters.
Right. Okay. So, may I also know who's going to be the person that you would be wanting to take her to? You were saying there's
No,
another
no.
physician or another
Yeah, no,
doctor near home.
see, we want to try the alternative treatments. We've
Okay.
seen how the things are happening over here, and we've been told कोई hope नहीं है. We don't want to go for an amputation. We just want to
See,
take her,
every
and
day
I
you are
don't think
telling
so.
some
It's
one or the other things.
and it's
Sorry.
our decision. I think we can always take her home. Like
Okay. Yes, definitely. I mean, you are
The
entitled
primary thing
to.
is she is not getting relief from anything.
Okay. Right. Do you feel she also has a belief in
See,
alternative
you are
treatments?
the main doctor of my our mother.
Yes. I work with the other doctor in the
so,
team.
yeah. So even you
I
let
think we
us
should
talk
meet
to the
the
primary
consultant.
consultant. Yeah.
Okay. So definitely, I mean, this is something that we could discuss. Probably we could have another meeting with him if that is
No,
okay.
Shikha, I'm just thinking they are avoiding us and it's all money thing. We just want to go home. We don't want to keep her here, please.
See, you are also daughter of some of your mother, but you can understand our problem. And
Right.
we can't see our mother in such a situation where you just try to convince us and not giving relief to our patient.
No, I understand. I completely agree that it is a very distressing situation and you are looking out for the best for your mother. But
Yes,
we
yes.
also understand that after evaluation from our end, the understanding is that there is an infection which requires a surgery. But more than anything
Five
else,
days are enough, I
obviously,
suppose.
sorry,
5 days are enough.
correct. So
Arre,
5 days are
we
enough to
don't
give
even
us
know
relief.
she's got infection from here or where because earlier when she came her things were fine. But नहीं हमें घर लेके जाना है यार. It's like
So
we just want to
try
go. You
to give us
let us
Lama
know
then.
the you let us know the procedure what to do.
yeah.
Thank you. Can I request everyone to come in? Sorry, Michelle, to have put you in that tight position.
Sorry, Michelle.
But that's what we
I
have to
went,
learn.
sorry, but I started off with reading the
So
case. I
this is how
without
we are grilled.
I started.
This is how we are grilled every day.
So I think we'll start, Michelle, with you. What do you think you did effectively? You did a lot of good things, but what do you think you did effectively?
So introduction was fine. I mean, the second time around. But I think I gave them a chance to say what they wanted to say when they were both
Mhm.
talking, and I knew that, telling them otherwise is not going to help. So somewhere I knew it was important for them to have the autonomy, but it concerned me that their mother didn't know.
Mm.
And they were making decisions on behalf of her. So So eventually I would have definitely got to a point where I would have agreed for the Lama. But I mean,
You would
because
have agreed? You would have agreed?
I would have agreed for
Well,
that.
I understand because they were very adamant on it.
Yeah, and I guess at some point of time, 5 days is a long time. So they did definitely lose trust. We don't know the details of what they've experienced over that course of 5 days. Some of the question was also about their expectations, what they expected when they came in.
True, true. So if I may ask Shikha and Mitu one by one, please tell, what do you think Michelle did well, that really, made you feel that, yeah, she's doing her role well?
She was very calm, having
Absolutely.
patience a lot,
Absolutely. Calm and patient.
giving the time to the family members also to speak up. She is a
Yeah,
good listener.
yeah. Very good. Agreed. So she was listening
So
to you with a lot of patience and calmness. She allowed you to speak whatever you wanted to speak.
Yes.
I agree. I agree. What else? Mitu, anything from you?
she was assertive also. She didn't just say ki, she didn't get irritated. She took her time. She tried explaining it to us,
Mm,
and that's a typical situation. But yes, because she know it's a right of every patient to have a second opinion or go, she inquired about, like, does the patient know about that? And I think assertion was one thing which I really liked about it, because she was very clear on the fundamentals,
mm,
and very nicely being told to the family also with a lot of patience and calm.
mm, mm. And she did bring your attention to the point that we got to respect patient's decision also, and we need to take patient's consent. I mean, you can't just
Yes.
decide on anybody's behalf. At least the patient should know what is being decided for him or her. I think that was a good point that she brought forth. I appreciate that really. Agree. So, Arshia and Maheshwari, what did you find good or effective in Michelle's role play? One by one, maybe by Maheshwari first and then Arshia. Go ahead, please.
Michelle was very empathetic, ma'am. The way she handled the patients, though their attenders or supportive people were so adamant.
Mm.
Sorry to say that word, but the
Yeah.
way they had put, they were like, they were not ready to listen. They were not ready to listen what Michelle is going to say, and they were not ready. They were like fixed that they want to
Mm,
take mother home.
mm,
Whatever she is going to say, any other alternative, she's ready to give some alternatives also, but
mm,
they were like fixed mind and they want to take back home. And immediately they were bringing up some, it's all about money and what Me Too said and all that. So no doctors are going to listen so patiently like Michelle. I
mm.
would, it's
Absolutely.
so
I
she
agree.
did a good
Absolutely.
job.
She
Yeah.
did. Arshia, anything that you observe which they have not been able to point out? Something that Michelle did well?
I think Michelle asked the right questions as well. As in, um, she asked who is the primary decision makers. I
Mm,
mean, also understand as a doctor whether, for example, me, Tu, and Shikha, are they actually the decision makers for the patient?
mm,
If Michelle, as a primary physician for the patient, is going to release the patient, is she
mm,
giving the patient in the right hands or not?
mm,
Secondly, she also inquired very clearly whether it's a patient's decision as well.
mm,
And then she also wanted to understand what is the next thing that they are planning for,
mm, mm.
and if that next thing that they're planning for is something that is right for the patient or not.
Yeah. Yeah.
That's
It-
and eventually,
patient-
I mean, the
yeah,
decision or
yeah.
the argument that she would have given would have also been based on her experience with those alternate therapies, and then whether the patient should be released or not.
But they were not willing to discuss. They were not open to discussing. The family was not
Yes.
open to, because they said we don't want to talk all that. We want to just go. And I think this is how usually the whole interaction ends up, where the family is
In
just
this
they're made
role,
up. Yeah,
sorry.
go ahead.
In this role play, was the Michelle who owns the hospital or she's working for the hospital? That
It
makes a
doesn't
lot
make
of
a difference.
difference.
It doesn't make a difference. It
Is
doesn't. See, approach has to be very professional. And the whole idea when the patient wants to go Lama is to help them understand why the patient should not go. And um, We will talk about it in a minute. So I think everybody has given excellent feedback. Michelle, you introduced yourself. You heard them very patiently. You were calm. You were assertive. You were. I mean, one point that you brought in was patients' welfare, patients' interest. That probably usually we don't really directly ask for. We normally think that it is the family, or we assume especially in India, we know it's the family who takes the decision. So we don't care to ask what does the patient want, or does the patient know that this is what we are deciding on the patient's behalf. But that was a excellent point that you brought in. And like Maheshwari said, that you were very empathetic because you never lost your temper. You could see their perspective. Even if even if you didn't agree with them, you were not aggressive and annoyed about it, that why can't you understand? That was really very good. Michelle, given another chance, if you were asked to do the same role play once again, anything you think you would have done differently? Because now we have had some discussion. So anything that comes as an afterthought?
Yeah, I would have probably said I'm the primary physician.
But here,
Suddenly, like it dawned on me, like, okay, can we like elongate it? And correctly, Dr. Meetu caught on and said, hey, they're just, playing with us, they're spending a lot of time. So I wasn't sure whether at that point we'll have to get a little bit more medical, obviously. So I backed out and I changed it. So probably if it was a
so here I want to really bring in one very important aspect of our interaction with the family. Day 5 of my patient with me. By now, I should be knowing the primary caretakers from the family side. Actually, on the day 1, I normally recommend on the patient's case sheet, you must write the name of the primary caretaker. It is usually the children, husband, wife, parents, usually the first blood. If you write their name and their phone number, and you make sure that you always interact with them for every and any communication. Day 5, I should be knowing them very well. I don't have to introduce myself. I don't even have to ask for their introduction. So if they're entering my room, the moment they are in my visual field, I say, "Arey Shikha, आओ आओ कुछ बात करना चाह रहे हो क्या? आओ बोलो बोलो क्या कहना चाहते हो?" So now, if that's my interaction, there is already a background that I know them, they know me. Suppose मीतू पहली बार ही आई है, because मीतू कहीं बाहर थी और वो कल ही आई है, तो मैं शिखा से पूछूंगी, शिखा ये कौन है आपके साथ में? तो मीतू से शिखा विल से कि मैम ये मेरी सिस्टर है, ये बाहर थी, ये आज ही आई। ओके मीतू, आओ आओ, आप भी आओ, बैठो। क्या जो 5 स्किल्स मैंने आपके साथ सेकंड सेशन में डिस्कस करे थे, trust me, those 5 skills you can apply in any sphere of your life. The first is building rapport. The moment they come into my visual field, and I show that I know you, I recognize you, I know your name, I know about your patient, the whole perspective changes. If you want to be in control of the situation, it's not the authority, it is the respect that you have to command from your patient. And that is, I know you and you know me. And we are together on this. So that's one thing I would recommend to everyone, to make sure that you should know the patient's primary caretaker. नाम लिखा होना चाहिए केस शीट के ऊपर, और हमें 5वें दिन तो पक्का पता होना चाहिए कि कौन। It shouldn't be like, okay, आप कौन है और आप कौन है. Nothing like this. I know you. That's one thing. Okay. Anything else, Michelle, you think you would do differently?
I noticed somewhere in my own mind is getting caught up between whether you need to be talking about it medically or whether we need to be giving them a space to kind of vent their emotions, because they were
I'll do the same role play now in your place. See, we have to understand their concern and answer those questions, but in a manner that they understand. We will do this role play. Once again, I'll do that. Okay, so others who were observing, okay, Shikha or Mitu, only one of you will say, but only one point, not multiple points, that you recommend to Michelle, that, I mean, this would have really helped us in thinking or reconsidering our decision. Because you have already made up your mind to go Lama. So anything Michelle could have done, which could have made you, consider or reflect on your decision?
If she could give us the progress things from day one, then it would be easy for us. Day 5,
So that's very important, Shikha, what you're pointing out. So that means ideally we should be updating the family at least twice in a day. And that should also be documented. So even if the family told me, आपने 4 दिन तो कुछ बात नहीं करी, अब आप ये कह रही हो कि ऑपरेशन होगा और 4 दिन में आपने क्यों नहीं करा, तो मैं then I can say कि शिखा आप नहीं थे, लेकिन जब हमारे विजिटिंग आवर्स होते हैं तो जो भी फैमिली का अटेंडेंट होता है उसको हम बुलाकर एक्सप्लेन करते हैं पूरा और सिचुएशन बताते हैं, और जो हम आगे करने वाले हैं वो भी एक्सप्लेन करते हैं। और ये देखो कल शाम को कोई शालिनी नाम से थी, कौन थी, आपकी कोई रिलेटिव है? तो आप कहते हैं हाँ हाँ ये मेरी मामा की बेटी थी, आई हुई थी और मैं घर गई थी कुछ सामान लेने के लिए। सो आई डॉक्यूमेंटेशन विल कम हैंडी एट दिस प्लेस.
But ma'am, in India, it happens mostly. Either we can tell the patient family side that on day 1 only during the counseling that try to be only one person at the time of the counseling or whenever you meet the doctor, concerned doctor.
अगर पहली बारी आप उनको जब ब्रीफ कर रहे हैं तो मैं ये कहूंगी उनसे कि देखो हम दिन में 2 बारी ब्रीफ करते हैं, सुबह जो है अराउंड 11 बजे हम बुलाते हैं पेशेंट के अटेंडेंट को, और इवनिंग में अराउंड 4 o'clock बुलाते हैं। तो मैं चाहती हूँ कि आप हर बारी यहाँ पर हो, क्योंकि आप एक बारी मेरे से बात कर चुके हो और आप भी सिचुएशन अच्छे से समझते हो, पेशेंट के सबसे क्लोज हो आप, तो उस वक्त आप पास रहना ताकि मैं आपको बता पाऊँ, और आपके मन में कुछ भी सवाल है आप मन में तैयार करके रखिए। नेक्स्ट मीटिंग में जब आप आएंगे तो मैं आपको पूरा अच्छे से उसके आंसर दूंगी। So what am I
one who is giving the history?
I'm explaining, yeah, because they are the one who gave me the history, so they are the one who need to be updated. But I need to inform them that these are the timings when I will be updating you. So you are requested to be around. Otherwise, देखो जो भी होगा फिर हमें उससे बात करनी पड़ेगी। तो हो सकता है उसमें आपको उतनी तसल्ली ना हो और हमें भी नहीं होगी, बिकॉज अगर आप एक बारी आप मिल लिए आपने और आप हर बारी अगर आप मिलोगे तो फिर उसके बाद आपको पूरा पता रहेगा कि हम क्या कर रहे हैं आपके पेशेंट के बारे में, या क्या चेंजेस आए हैं, या अभी और आगे क्या करने की जरूरत। तो अच्छा होगा ये हम पहले इंस्टेंस पे ही अगर हम बता देते हैं पूरी फैमिली, सो देर इज नो रिस्क ऑफ कंफ्यूजन कि पहले ए ने सुना फिर बी ने सुना फिर डी ने सुना। You know that you can, I mean, you are talking to the same person every time. That also brings in continuity of conversation. So that's a very valid point, Shikha. I think what you brought. Meetu, anything you wish to add here?
मैम मुझे लगता है अगर उसको थोड़ा क्लिनिकली क्वालिटी ऑफ लाइफ इम्प्रूव होगी पेशेंट के लिए, यू नो देयर अगेन वन पर्सन वुड थिंक कि अच्छा ठीक है ये बेटर हो सकता है। दैट्स वन थिंग आई
एब्सोल्युटली आई थिंक एक्चुअली देखो यहाँ मीतू क्या हुआ कि जैसे आप और शिखा बात कर रहे थे, मिशेल कुड नॉट कम आउट ऑफ दैट ट्रैप, बिकॉज आप दोनों ने एक ट्रैप बना दिया, हमें जाना है हमें जाना है हमें जाना है हमें जाना है ना। सो नाउ यू डू द सेम थिंग विद मी, जो भी आपने मिशेल के साथ करा आपको सेम वही करना है। डोंट थिंक दैट कि हम ऐसे नहीं बात कर सकते, यू कैन बी मोर रूड देन दिस, कुछ भी बोल सकते हैं, बट व्हाट आई वांट एवरीबॉडी टू लर्न हियर इज कि मुझे कैसे उससे बाहर आना है और आपको कैसे मैंने कुछ और दिखाना है। ठीक है, सो विल टॉक अबाउट इट, विल टॉक अबाउट इट। सो महेश्वरी, anything that you would like to advise Michelle, और यू वुड लाइक टू से कि हम ऐसा कर सकते हैं, ऐसा करें तो शायद हम अच्छे से, जैसे मीतू ने कहा कि थोड़ा अगर आउटकम के बारे में हम फोकस करेंगे तो वी विल बी एबल टू हेल्प देम सी व्हाई दिस ट्रीटमेंट इज इम्पॉर्टेंट एंड व्हाई नो अल्टरनेटिव ट्रीटमेंट विल वर्क इन सच केस। एनीथिंग महेश्वरी और अर्शिया, एनीबडी इन केस अगर आप कुछ आइडिया आता है तो। अर्शिया, एनीथिंग फ्रॉम योर साइड?
I think one thing that could have been done at that time was to explain the disease to the patient caregivers once more. That diabetes complications ये किस वजह से हो रहा है और उसके बाद मतलब और क्या complications हो सकते हैं if it's not controlled.
Absolutely, I think you're spot on, Arshia. I think that's what is going to make them rethink. So couple of things that you need to ask, पर मैं पहले रोल प्ले करूंगी और फिर I want everybody to now observe what I did you think really worked for me. Is that okay? So now only me, Shikha and Meetu will be there. Rest of you can have your video off. And I'm assuming that I'm in my room and both of them have come to my room. ICU में ICU ही मान लेते हैं, ICU में आपके पेशेंट है, मैं ICU में ही डॉक्टर्स उस पर बैठी हुई हूँ। एक सेकंड होल्ड कर लो। I'm in a class. I'll call you once I get free. Sorry. So मैं assume कर रही हूँ कि मैं वहाँ पे डॉक्टर्स काउंटर पे बैठी हुई हूँ और
Ma'am, sorry to interrupt. Not very comfortable in Hindi, so if conversation goes in English, it will be fine.
Absolutely. Thank you, Maheshwari, for pointing out. I'll make sure that we stick to English only because it's very important for you to understand what I'm saying and what I'm explaining. Thank you. Thank you. Okay, so I'm assuming that I am in the ICU at the doctor's counter. I'm doing my work and you both come in. Shikha and me too, you both come in. And I have seen you now and I'm saying, Shikha, oh, you are Mina's daughter. No, I have met you earlier. Who is this with you?
She's my sister, elder sister,
Okay, okay.
and she also wanted to have a converse with
Oh.
you
She
regarding
was
my.
not, yeah, she was not here. No, I have not seen her for this.
She just reached.
Okay, no problem. Aye, please come in. What's your good name?
Me too.
She's
Me.
me too.
Come in, please. Me too, you and Shika, both take your seat. Do you want to discuss something? Is there something that you want to discuss?
We wanted to listen from you first.
Okay, tell me what exactly do you want to know? I'm ready to help you.
No, actually, we wanted to take her home. We are not very comfortable with the kind of treatment and the outcomes and outputs we've been told about by the doctors and the nurses over here. So we would like to take her home and try an alternative treatment because I don't think so the things are working very fine from the last 5 days. And
Me
we
too.
are a little
They have
clueless.
not told us anything about the progress things.
So have
Today
you not
itself
met
in
the
the
doctor,
morning.
So
Shikha?
me too, and Shika. See, I know you both appear to be very apprehensive. That's why both of you are doing simultaneous talking. And I completely understand your anxiety. See, it will be good if one of you speak and then allow me to understand your point of view and answer you. And then maybe one by one, I can try to address your concern. I'm sure your concerns are very genuine. So, like Mitu said, first of all, that she wants to take home. So, Mitu, you want to take her home or you want to take her for some other treatment or to some other hospital?
See, I want to take her home. I also had a word with her because she's also not very comfortable sitting here because nothing's happening. She's increased the infection over here, and now if you're suggesting amputation, it's a shock for her. And we really want to try something alternative, and we'll decide as a family together and understand what we want to do. We want to go for. We have a local, kind of a physician also who has very good results. I've heard it from a lot of people. People have gone there; they don't have to go for amputation, and that's how we want to. We want to actually go take her home and decide how do we want to do that.
So Mitu, the thing is, for the last 5 days, actually, we were trying to control the infection using medicines because that's what we normally try to start with. What happens when somebody is high diabetic, and if the infection, stays in an area for very long, it literally leads to necrosis of the tissue. Necrosis in Hindi, in simple language, is like death of a tissue. So if you have
You
seen
are
that.
telling all these things today. For the past 4 days, no one has explained us in such a layman language. I'm not a medico, so I
think,
can understand the things.
Chika, I think every day, twice in a day, we talk to the family
True,
members.
but the language is
I
not as per the layman language. You're just using the clinical things. So
I
you should tell us in a layman language that see these are all things are happening.
Chika, I
But now
completely
you are
understand
telling
you.
me the scenario what is happening when you are telling the some surgery has to be done. This is
Chika,
not fair.
I think what we do, we normally update the family twice in a day about the patient's condition. So whenever you were there, I think I have the record with me. I can show you. Whenever you were there, I spoke to you, or one of my doctors spoke to you. And every time you came asking for something, I always tried to answer you. So let me complete what I was trying to explain to me too. And whatever concerns you have, I will definitely address. See, the thing is, for the last 5 days, we were trying to control the situation using medicine because even we understand foot amputation is a very big decision. We never wanted to take this decision without exhausting all possible options. In her case, we have tried everything. We have discussed with orthopedician, we have discussed with diabetologists, we have a team of surgeons, everybody, like we have discussed your mother's case in detail. And we have also got the tissue study done, which has clearly shown that in case if we do not, amputate her foot, the infection can actually go to the other parts of the body. It's a very big decision. I completely understand. It must be very devastating for anybody. I'm not
I think we
surprised.
have taken the decision.
But I think, doctor, if the amputation was one thing which was supposed to be advised after 5 days, we were never even told prior that this kind of a prognosis is she landing into.
So, Miti, one of the reason why we normally don't always say in the beginning that maybe we will have to go for full-time amputation is because it is a very big decision, and we don't want to reach to that decision unless we have really, tried everything. So, honestly, in her case, we tried everything. We have had a discussion. Our team actually sat and did the case discussion about your mother. We have done all investigation. And after that, we have come to this decision that the only way to save her life is that we have to go ahead with amputation. And I understand it's a very big decision. It has come as a shock to you. I'm sure for your mother as well, it must be really very shocking. Of course, we will work with her. We'll try to discuss and explain to her why that's important. But if you want to go for second opinion, which I completely respect, because anybody in your place this is a big decision, so you will not take it, just because if I'm saying and you would agree with it, I'm sure you would like to go for second opinion. I can make a summary of your patient's case if you want. I can give you the summary. You can talk to the different doctors whom you know. And you said you have a doctor in the family, or you have a friend who is a doctor. I mean, I'll be happy to speak to that doctor and explain to him about your mother's condition. And then maybe after that, you can discuss with him. Or if you want to make a summary, I'm ready to give you a summary of your mother. You can go and discuss with other doctor. And second opinion is an excellent option, actually. One should not hesitate. I'll rather cooperate and see that you are satisfied, because this is.
Yesterday we had asked your doctor and she refused. And now today you are telling that you are ready to give the second opinion.
Shika, I'm sure what you're saying must be true.
Yesterday it was Sunday and some other doctor was there and she told that everything is going fine. And all of the sudden in today's counseling, being a doctor, primary doctor, you are telling me that everything is wrong and now surgery has to be done.
Shika, if there is some misunderstanding, I apologize for that. But at the same time, such a
No,
big.
there's no misunderstanding. We have clearly asked for this.
From our side. I'm not saying you have misunderstanding. What I'm trying to say, it's such a big decision that our junior doctors would not have communicated.
Ma'am, you're on mute.
Am I audible?
Yeah, it's audible.
Okay. So honestly, I mean, we normally ask our doctors and nurses to not to talk to the family, and therefore we directly talk to the patient's family, because I know it's a very big decision.
See,
But
yesterday it was Sunday and they were telling something else. And we were happy that, okay, everything is going fine. Then they should not speak up like this. If they are not aware about the patient history and all the things.
Ashika, I completely understand that you are unhappy about how they have communicated to you. But right now you have come to me with the decision that you want to go Lama.
During one night you have taken the decision of such thing, and today morning you are telling something else.
Shika, it's not one night. It is for the last 5 days we have been working in the background, and I have been always updating you.
It's wrong, and I don't understand the things, what's going on.
So what do you want to do now? Tell me what do you think?
We just wanted to take our mother back. We'll try some alternative.
That's completely your call, because it's your patient. You need to take a decision. But Mitu, I would suggest that whatever discussion we have had, both of you please go back, discuss with your family members in a peaceful manner. I know right now you're very overwhelmed, which is completely understandable. I would suggest that you discuss with your family the options I'm giving you. Discuss those options. I'm ready to give you a short summary to go and discuss with some other doctor you want to consult. Or if you have a doctor in your family or in your friend circle, you can make me speak to them. I'm ready to explain. Even then, if you want to go Lama, I'm perfectly okay. But only thing is, what I would tell you honestly, in such cases, please do not delay the treatment, because once the infection spreads to the body, you will not be able to control it. It might.
Maybe mother is also don't want to be in this hospital. She is not comfortable here. So let's take the summary, and then our decision is final. Although you are giving us the second opinion summary, we'll take it and discuss and decide.
Sure, that's what I'm telling you, Shikha. Go back, discuss with your family, and you can come back to me. I'm here only till evening 8 o'clock. You come back to me, and whatever cooperation you require from us, we'll cooperate with you. Is that okay?
Now you can say all these things. Yesterday it was something else. Past 3 days you are telling something else, and now today you are telling something else. So let's take the summary. Give us the summary, and then let's go.
So,
I
Mitu,
think
are you okay with this decision? Mitu, are you okay with this decision?
I think because see, I had to travel so much. I came here, and it was not a panic thing. I came here, just came as a regular visitor to her. But the moment I entered her, they just told that we need to amputate. And I asked Shikha, like, when did we decide all this? No one knows about it. And the risk,
So,
what
Mitu,
is
I
the
think
risk? What is the benefit? We don't know. We've not been
absolutely.
told. And
So, see, right now, what I'm suggesting that you discuss whatever we have discussed now with your family. If you have more questions about your treatment, I'm ready to talk to you and to your family member. In spite of that, if you decide to go Lama, it's your right. Whatever cooperation you require from me and my team, we are ready to cooperate with you. Is that okay?
Yeah, thank you so much. We'll decide and we'll take our own back.
yeah, it's decided because let's put it. Thank you. Thank you,
Yeah,
doctor.
thank you so much. Thank you.
Thank you. Can I request everyone to come in?
You were really grilled.
I know. See, I think one thing that Shikha really, brought home for for our attention is the family should have been updated regularly. So the claim she is making is that they didn't understand. They didn't understand. They were not communicated. They were not explained. If that's the reality, then definitely I am at fault.
But you
And
had
this is
records
what I
with
have experienced in my hospital every day.
I understand, Shikha. That's why you were not budging. You were, but see, normally, if this is my stand now, then I'm sure I would have connected with the family right from day one. I would have communicated. I would have
Hospitals
updated.
are
I would
doing
have.
counseling.
Yeah.
Very
ma'am,
true.
But you are
But
right
they
now.
are
You are
very
you had
experienced.
the
regularly.
records.
I agree. I agree. And that's why I can't say, no, no, no. I told that I have updated, but you were very adamant on it. So I decided that let me not push you now to that. No, I have discussed. No, I have explained. No, I have done that. I said, I don't want to get into argument. I brought your focus to the present situation and what next. Okay. Maheshwari, you were wanting to make a point.
No, ma'am, that's what you answered my point, ma'am. Actually, you told her that I have explained you and we have the records of updating the primary caretaker about the patient's condition every day. You had records, but still, in spite of that, the caretaker was denying that nothing was being updated and we were not aware of what is the patient's condition.
Maybe actually they were not approached in the right manner. They didn't understand. The language was not okay. Jargons were used, and they were not never mentioned about amputation. Although I explained to her that amputation is a very big word, and normally we do not start with it. We build on it. We start with the infection, seriousness of infection, how things are going bad, what tissue study has brought up. All that we would have discussed. But amputation, maybe I have brought up on day 5. But normally, I think if a doctor is in good communication with the patient's family,
But
somewhere
the reports and all would be taken priorly before the amputation, no, ma'am.
whenever we take tissue sample, we normally
Yeah,
tell we are
yeah.
sending this sample and we are hoping that this will come out to be healthy. But in case if it turns out to be necrosed, then I think we'll have to, you know, and maybe when that's the power of prognostication. Prognostication is a very, 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 very important step right on day 1 actually, and then continuous updating. And that's where Shikha pointed out that me or my team failed. But I did not insist on no, 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 we have explained to you. Maybe I explained and she didn't understand. Maybe my language was not okay. Maybe the way I explained was not okay. And I can't argue on that. I can't lose my patience on that. I smartly shifted her focus to the issue right now, rather than arguing on it. That no, no, I have all the evidence that you have attended the counseling session. Okay, what do others say? What do you think? I think Neetu would like to share her.
So what I liked about one thing was like you tried breaking both of us. Like, आपने बारी बारी बोला कि नहीं नहीं मीतू तुम बताओ. you tell, what do you think? Because you found like this one sensitive part where the outcome or anything would, make it up. And just to put it, like, I have a friend, he's a neurologist. What he does not meet the patient attendant without the primary person. If on his rounds the person is not there, he will not counsel anyone. He tells them, come to my room. He has fixed the time for such people, and he gets it signed there and then, and tells them, what has been explained to me, I understand in my own local language. So because such situations have been very
Helpful.
common.
It's helpful, one, because
Yeah.
it brings clarity that the other person has actually understood.
Yes.
And second is, now I have documented with my hand, so I can't deny that.
Yes.
So it serves both the purposes. Absolutely. Okay. So what other learning point, Ashya, Maheshwari, and Michelle, you want to add?
I think it was perfectly handled. That's what I would like to say, because you were, in spite of, uh, you know, and this is a very real situation that happens, because the thought, even, the thought of amputation is very, very worrying for the patient. And this is something that makes them overwhelmed, and, makes them doubt the very, treatment forward. From that perspective, to be able to listen to them also, and then explain to them in, not just in the medical terms, but when required also in the lay language, what needs to be done and what should be done, giving them the right advice, and also giving them the right to go for the second opinion, and saying that you can have the summary from me. Because normally what happens is doctors get angry about it. Okay, take your patient, you can take her, I don't mind, things like those. So from that perspective, to be able to really back the patient with their decision, and even if you take the other decision, we are with you, we will not be angry with you, or we'll not like bar you from or block you from treatment from us or something like that. So I think that's what really mattered. And I think at the end of it, both Neetu and Shikha could really agree to the decision that, or come to trust you as a as the primary care physician.
And what Neetu pointed out, that's a very common situation where you will find somebody agreeing with you when they're nodding and when they're, looking soft. That shows that they are understanding your point of view and they're agreeing. So take advantage of that situation. I'm not saying to manipulate, but just to take advantage of that situation, because there is somebody who is understanding your point of view, who is not that badly clouded, and who is able to see that you are talking sense. And that's very important, to connect with that person rather than arguing with the other one who is just, not ready to buy. So, Shika, what did you like in the way I handled you?
The first thing, you have already tried to explain each and everything. You have told the procedure, that there is a procedure, that we have documented the thing. If you are thinking that you will say anything and will listen, but no, at the end, if you say this thing, we have documents, we have evidences, and you can't say vaguely that no, we have not known about these things. So that is very important for the patient family side, because many
Documentation
times
is
they don't
very
say this.
important. Documentation. So here, see, if Shikha was adamant that you didn't explain. Maybe I have not explained. Maybe she was not there when I explained. Maybe I did not explain it properly. It could be anything. है ना? But if I have documented, then in case unfortunately tomorrow it becomes an issue, then I have something in my favor, which clearly says that I've spoken to the family member twice in a day. How can you deny that you have not spoken to? So that's, so those five skills that I said: building rapport, attentive listening, empathy, positive and helpful attitude, and assertive communication. If you remember these five skills, I brought them all here in this situation. And any situation can be held where if you are able to integrate all these five skills in any. And now the difficulty level will increase. Today we are discussing about uncooperative patient. Next we'll be discussing about how do you handle complaints? Even then people become aggressive and they're complaining and agitated. And when people become aggressive, in all situations, you will require these 5 skills. And please remember, when you're doing a role play, try to bring in these 5 skills in your interaction. You will see the quality of your interaction. That's what is desired. So this is about the role play. So do you remember the 4 communication styles we had discussed? You had even taken a questionnaire and you all got to know your communication style. Do you remember those 4 communication styles? They're very important. You can't forget them. See,
Visual?
No. If you are not remembering, that means
Passive communication.
4 styles. The questionnaire that we took on communication style was one was passive communication, passive aggressive communication,
Passive aggressive,
and assertive.
assertive.
So what did I explain in passive communication? Somebody, one person, anyone. अगर ये याद नहीं है तो we haven't taken our training seriously.
Going silent
Okay.
and not responding actively.
Sorry.
Passive communication is something like your volume, your pitch, or some body language or something.
You're not talking at all. You're not participating. You're not expressing yourself. So you're in passive communication. Somebody is shouting at you and you are just okay with it. It's okay. It's your right. Go ahead. You are my boss. So you have all the right to be aggressive with me. That's passive communication.
And lack of confidence also.
Lack of confidence. Performance.
Yeah, lack of self-respect. Like you don't comment.
Absolutely.
Cornered, you
You
know.
don't respect yourself, so people don't respect you. Oh, as simple as that. The belief is that others are smarter, others are more intelligent, others' needs are much more than important than me. So I am nothing. I'm worthless, I'm useless, and I'm okay the way I am. What about passive aggressive communication?
So when we don't talk to the right person, if you have some kind of a grudge, you will not go to the right person. You will speak here and there, like this didn't happen. I would have done this.
Absolutely.
Basically,
So you're not addressing the concern with the right person, but you are going and gossiping and backbiting with others. So again, you're not addressing the issue, but you are just venting out.
Yeah,
What
you
about
won't take a stand.
Yeah, you will not take a stand. Absolutely. What about the third style?
Quick to become aggressive.
Aggressive.
Yeah.
So if you're aggressive, what happens?
Shout, find fault.
Especially if you're in authority
React.
position. Because you know you can. You can afford to. The other party can't do anything. They are powerless. So I have all the right to be rude and arrogant with them.
So when not happy with you, intimidating, you'll just, you'll make the whole conversation a little more into an aggressive tone.
Blaming and finding fault and demeaning somebody, putting somebody down.
Yeah.
The whole communication will be, showing me more important, more powerful, more intelligent, more knowledgeable. And what about the fourth one?
Assertion.
And what happens in assertion?
So your tone has to be quite audible and friendly, and you stick to your point. You have to be confident at that point, and you have to put it in the right way.
Absolutely. So that means assertion is the right communication style where you express yourself confidently in an open and honest manner. So communication has 3 parts: language, paralanguage, body language. Have we discussed this part earlier? So you remember in assertion, the language has to be respectful. So if you saw me speaking to Shikha and Meetu in the role play, was I anywhere disrespectful? तुम कैसे कह सकती हो शिखा कि मैंने तुम्हें एक्सप्लेन नहीं करा? मैंने तुम्हें बताया है, मैंने बताया था, देखो लिखा हुआ है तुम्हारा नाम, तुमने साइन करे हुए हैं, तुम कैसे कह सकती हो कि तुमने बताया? दिन में 2 बारी तुम्हें बुलाते हैं और तुम कह रही हो मुझे बताया नहीं. आई एम बीइंग डिसरिस्पेक्ट. Sorry, Maheshwari, I went to Hindi because so when you are aggressive, your language goes down. And when I know I can shout, I will. So that's language part. Paralanguage you observe, I was rude, aggressive, intimidating. My body language also was, aggressive. In assertion, your tone of voice, and if you saw, I mean, I was communicating with Shikha and with Bitu in the role play. Nowhere I used any harsh tone of voice or intimidating or rude or aggressive or, but I was firm. I was clearly explaining. There was a point when both of them were talking. I even went to the extent of saying that if you both talk, I wouldn't be able to answer you. It's better if one of you speak at a time. And I reply that, and then maybe we can take the second concern and we can talk. So in assertion, your language, your paralanguage, and your body language all have to be in fine-tuned. So I'm going to show you 4 videos. They are my in-house videos. So Maheshwari, sorry, the video will be in Hindi, but I think you will be able to understand. You will be able to understand. So let me show you the same situation, and I'm handling in 4 different ways, and you will be able to make out what it is like. Give me a second to show you the videos.
मैम हाँ जी मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं कहाँ और दूसरा हॉस्पिटल जाने के लिए कह रहे हैं उनके जो रिश्तेदार हैं क्या कह रहे हैं मैं डिस्चार्ज कर दूं दूसरा हॉस्पिटल जाएंगे और उनका बेटा हाँ जी जिसके साथ जो है ना वो कह रहे हैं वहीं के हॉस्पिटल में एक बार आप फिर बात करा दो बात से लिसन कर जाने दो क्या करना है कौन से कपाई करेगा छोड़ो करो कपड़ा खींच को बोलो डिस्चार्ज स्लिप बना दे आप अपना बेड क्लियर कर लेना ठीक है बना दो डिस्चार्ज स्लिप बना दो
So what did you notice in this video?
Passive.
Not ready to talk. No open communication, like more of a passive.
Anything else? Others?
It leaves the other person quite confused. Like her non-verbals were like, okay, what am I supposed to do now?
How do I
Right?
handle
I'm telling you all this information and you're just, kind of like stonewalling almost. She didn't know what her role was next.
And especially if you're in leadership position.
Correct.
This
They're
happens
looking out.
typically with all bosses, ma'am. बस मतलब ये करके आना क्या कब कहाँ कैसे सोच लो.
Because usme the responsibility does not come on them, no? They know it. That is like, whose monkey is that? So sometimes bosses also throw their monkey on their subordinates. So did you see? She didn't interact. She didn't talk to the patient or the patient's family. She didn't try to understand what is the concern, but she just took a stand, let it be. I don't think. So it was visible. So if somebody is using this often, you can imagine what will be the state of affairs. Nothing will happen. And everybody will do what they feel like doing rather than actual work happen. So let me show you the second style and let's see how do you find that one.
मैम मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं
कहाँ जाना है?
दूसरा हॉस्पिटल जाने के लिए कह रहे हैं, केवल डिस्चार्ज कर दीजिए, दूसरा हॉस्पिटल जाना है।
कौन कह रहा है?
उनका बेटा साथ में जी।
वो जो हर टाइम उनके साथ रहता है?
हाँ जी।
वो है ही बदतमीज, वो बिल्कुल बेकार आदमी है। और अगर कुछ ना कुछ उसको नया ही सोचता। अब क्या कह रहा है वो?
डिस्चार्ज करके हम दूसरा हॉस्पिटल लेके जाएंगे।
ये तो वहां जाके क्या इनको बहुत बढ़िया कुछ वो मिल जाएगा? क्या यहाँ पे इनको क्या तकलीफ है? क्या कह रहे हैं यहाँ पे, क्या दिक्कत है उसको?
कह रहे बस हमारे डिस्चार्ज कर दीजिए, हम दूसरा हॉस्पिटल जाएंगे।
नहीं तो वहां पे क्या, यहाँ पे इसको क्या दिक्कत आ रही है? कुछ बता रहा है कि क्या क्या प्रॉब्लम है उसको?
नहीं, ऐसा तो कुछ बताया नहीं।
कुछ बोला नहीं? अरे ये शुरू से ही ऐसे ही बोल रहा है, ये वहां तंग करने वाला बंदा है, किसी काम का नहीं है। भेजो, ऐसे बंदे से क्या करना है हमने? फिर और लड़ाई करेगा, जितनी देर ये यहाँ रहेगा तंग ही करेगा। कभी मेरे पास आता है, कभी कहते जी सिस्टर ऐसे कर रही है, कभी कहते जी सिस्टर वैसे कर रही है, कभी कहते जी पर्दे नहीं ठीक है यहाँ पे, कभी कहते जी एसी नहीं काम कर रहा आपका। बार बार कंप्लेन ही करते हैं। भेजो इसको, और डॉक्टर राकेश को बोलो इसकी वो बना दे।
तो बात कर लीजिए।
क्या बात करनी है? बदतमीज आदमी है, जाने दे, जान छूटेगी। कुछ बोलना मत उसको। उसको कह रहे हैं ठीक है आप बना देंगे। डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे और बिल क्लियर कर देना अपना। ये जो जाने दो, ऐसे लोग जाए नहीं रहे तो अच्छा। सारा दिन से खपाई करनी पड़ती है फिर बस। ठीक है, तुम्हारा क्यों मुंह उतर गया? जाओ जाओ जाओ, जाने दो। What did you find in this video? What did you observe?
कोई फर्क नहीं पड़ता, let him go.
Okay, good
The
observation.
message was not to that person, it was only to the attendant there.
And not addressing the issue. See, and this is very often, this is how people, handle situations. They will not talk to the right person, but they'll always talk to others and rant, but they'll never address the issue face to face.
That's how the essence of grapevine and all builds into it.
Absolutely, absolutely, absolutely. So you could see the body language, you could see the aggression, but not to the right person, but to somebody whom she knows she's not going to be of any harm to her. So let's see.
You will also tell the same thing to the attendant. Let's see, madam is saying such things.
She may, you never know.
Then the attendant will be more aggressive.
Yeah.
कि मैं देख लूंगा.
मैं भी देख लूंगा. Exactly. Yeah. So let's watch the third video, which is where she becomes completely aggressive with the patient, and see how she does it.
मैम आसू, मैम बेड नंबर 7 के पेशेंट जाने के लिए। मैम आसू,
Oh, I'm क्यों?
मैम बेड नंबर 7 के पेशेंट जाने के लिए करते हैं।
क्यों? क्या तकलीफ है उसको?
क्या छुट्टी करता हूँ मैं दूसरा।
I'm sorry. यार बहुत ही पागल आदमी है, हालत पेशेंट की इतनी खराब है, छुट्टी करो, रास्ते में कुछ हो गया तो क्या करेंगे? Give me 1 second, sorry. उसका जो बेटा है, जो उसके साथ हमेशा रहता है, बहुत ही बेकार आदमी है। जब देखो इसको, पहले तो इतनी नखरे इतने, कभी एसी काम नहीं कर रहा, कभी ये नहीं काम कर रहा, अब छुट्टी कर दो, छुट्टी कर दो। आपकी बात करा दो, भेजो उसको, जब सही करो उसको, भेजो। Where is the video? Maybe I clicked it twice. क्या तकलीफ है भाई, क्या हुआ? Sorry, I'll replay.
मैम आसू, मैम बेड नंबर 7 के पेशेंट जाने के लिए कर रहे हैं।
क्यों?
डिस्चार्ज मांग रहे हैं, कह रहे हैं छुट्टी करके हम दूसरे हॉस्पिटल जाएंगे।
फिर क्या तकलीफ है उसको?
कह रहे छुट्टी करता हूँ मैं दूसरे हॉस्पिटल जाएंगे।
यार बहुत ही पागल आदमी है, हालत पेशेंट की इतनी खराब है, छुट्टी करो, रास्ते में कुछ हो गया तो क्या करेंगे?
उसके साथ जो अटेंडेंट है वो कह रहे हैं कि हमारे डिस्चार्ज करना।
उसका जो बेटा है, जो उसके साथ हमेशा रहता है, बहुत ही बेकार आदमी है। जब देखो इसको, पहले तो इतनी नखरे इतने हैं, कभी एसी काम नहीं कर रहा, कभी ये नहीं काम कर रहा, अब छुट्टी कर दो, छुट्टी कर दो। आपकी बात करा भेजो उसको, जरा सही करो उसको, भेजो जरा। क्या तकलीफ हो गई, क्या हुआ है? मैम डिस्चार्ज कर दीजिए अभी। तुम्हें उनकी हालत पता है इस वक्त क्या है? तो पता है, लेकिन दिक्कत होगी इसलिए आप डिस्चार्ज कर दीजिए। मैं तो हॉस्पिटल तुम्हारे घर के पास ले जाऊं, डिस्चार्ज कर दो। उनकी हालत इतनी खराब है, रास्ते में कुछ हो हवा गया ना, ना इधर के रहोगे ना उधर के रहोगे। ज्यादा दिमाग मत चलाओ अपना। इलाज करवाना है तो शांति से करवाना चाहिए, ऐसे नहीं कि इधर भागो उधर भागो। इधर आने के लिए ठीक सा लगता है, और इधर आते भी बहुत ज्यादा भीड़ हो जाएगा, तो पैसे है नहीं हमारे पास। तो पहले ही सरकारी में चले जाना था, यहाँ आने की क्या जरूरत थी? आधा अधूरा इलाज करके अब जहाँ जाओगे तो वो लोग तो कहेंगे ना कि ठीक से इलाज नहीं करा उन्होंने, मेरा भी नाम खराब करोगे, रास्ते में पेशेंट को कुछ हो गया और मुसीबत हो जाएगी। आप डिस्चार्ज कर दीजिए भैया, बहुत ही बेकार आदमी है। डिस्चार्ज तो मैं कर दूंगी, पर दोबारा मुड़ के मेरे पास बताना। ये कोई तरीका नहीं है इलाज कराने का। अपने पेशेंट का भी नुकसान करेगा और मेरा भी नुकसान करोगे साथ ही साथ। हमारा आदमी है। सिस्टर, इनकी डिस्चार्ज स्लिप बना दो और बिल क्लियर करो इनका, तब भेजना है। जाओ, दोबारा मुड़ के मत आना मेरे क्लिनिक में। कहाँ से लोग आ जाते हैं। So I hope you could see how she handled aggressively, not trying to understand what is his concern, and all those 5 skills. I think none of the skills she displayed. Now let's see the fourth video, which is assertive communication. मैम आ जाओ। मैम मैं एप्लीकेशन दिखाने के लिए जाए। कहाँ जाना चाह रहे हैं? दूसरे हॉस्पिटल। छुट्टी के लिए गए हैं? हाँ जी। Should I restart it? Because audio video match भी कर रहा है। Give me 1 second. ऑडियो वीडियो मैच नहीं कर रहा ना। मैम आ रहा है। मैम मैं एप्लीकेशन जाने के लिए क्या? कहाँ जाना चाह रहे हैं? दूसरा छुट्टी के लिए गए हैं? हाँ जी। जो उसका बेटा बेटा जो साथ में वही होता है उसका। भेजो उसको, टाइम पर उससे बात करें। भेजो। आज भूपेंद्र नाम है ना आपका? आप इनके बेटे? जी। क्या हुआ इधर? जी मैम डिस्चार्ज कर दीजिए। कहाँ ले जाना चाहती हूँ? जी मैम किसी दूसरे हॉस्पिटल में जाएंगे जो अपने घर के पास में होगा। वहां से आने में बहुत दूर पड़ता है, और जो पैसा होता है नहीं, में आने जाने का खर्चा बहुत हो जाता है। देखो बेटा, अगर आप कहोगे छुट्टी कर दो, मैं कर दूंगी, मुझे कोई दिक्कत नहीं। तो मैं आपको ये बताना चाहती हूँ कि इस वक्त उनकी हालत जो है वो लेके जाने वाली नहीं है। क्योंकि एक तो जैसे यहाँ से अगर आप लेके जाओगे, रास्ते में एम्बुलेंस में लेके जाओगे, तो कैसे होगा कुछ नहीं कह सकते, क्या सिचुएशन में कुछ नहीं कह सकते। मतलब हालत इतनी अच्छी नहीं है, ठीक है। थोड़ी भी ठीक होती तो मैं कहती चलो ले जाओ, कोई बात नहीं। तो एक तो सबसे बड़ी बात ये है। दूसरा ये देखो बेटा, जैसे पिछले हफ्ते से हम लोग इलाज कर रहे हैं, मुझे काफी हद तक उनके बारे में पता है, क्या उनकी कंडीशन है। अब नए हॉस्पिटल जाओगे, नए सिरे से वो इलाज करेंगे। मैं बेशक तुम्हें पर्चे बना के दूंगी, उनका सारा डिस्चार्ज लेके दूंगी, जो जो ट्रीटमेंट कर रही। तो फिर भी एक होता है, एक डॉक्टर जो ट्रीट कर रहे होते हैं उनको पता होता है कि इस वक्त ये किस दवाई से इनको फायदा हो रहा है, क्या इनको नहीं सूट कर रहा। नई जगह जाओगे तो फिर वो नए तरीके से सारा हैंडल करेंगे। तो देखो, एडवाइजेबल तो नहीं होता बार बार डॉक्टर चेंज करना। और मुझे ऐसा भी लग रहा है कि पिछले 2-3 दिनों में थोड़ी, अगर आपने नोट करा तो उनकी कंडीशन में इम्प्रूवमेंट भी हुई है ना? इम्प्रूवमेंट तो हुई, बट उनकी पैसे वाली प्रॉब्लम आ जाती है।
देखो बच्चे, ये तो मैं मानती हूँ कि प्राइवेट में तो खर्चा आता है, अगर जहाँ भी लेके जाओ तो वहां भी खर्चा तो आएगा ही आएगा, ऐसा तो है नहीं कोई फ्री में हो जाएगा। अच्छा, सरकारी में अगर जाओगे तो वहां पे आपको मतलब वहां पे इतना पेशेंट होता है कि आपके पेशेंट को बेड मिलेगा नहीं मिलेगा कुछ गारंटी नहीं है ना। देखो मेरे से पूछोगे अगर तो 2-3 दिन की बात और है, जहाँ इतना सह लिया ये भी आप करें। बहुत मुश्किल है, लेके जाना चाहते हो फिर तो बेटा मैं जिद तो नहीं कर सकती तुम्हारे साथ, तुम्हारा पेशेंट है, तुम्हारी फादर है, तुम्हें डिसाइड करना है कि क्या करना है, जो भी करना था तुम कर सकते हो। पर मैं कहूंगी ये कि घर पे एक बार सलाह कर लो, अपने बाकी जो लोग हैं उनसे बैठ के सलाह कर लो, क्योंकि मेरा कहना ये कि 2-3 दिन की बात और है, जहाँ हफ्ता निकल गया, ये 2-3 दिन की बात है। फिर भी कहोगे तो मैं कर दूंगी छुट्टी, मुझे कोई दिक्कत नहीं, मैं पर्ची बना दूंगी, पता कर लो जहाँ बेड है, इतना खर्चा कम है, फिर जाने ले जाते। वैसे आप क्या, वैसे एक बार जाके घर में मैं डिस्कस कर लेता हूँ मैम, और पता करता हूँ कि 2-3 दिन की और बात है, और इम्प्रूवमेंट भी अच्छा हो रहा है उनका, तो शायद हो सकता है कि खर्चे थोड़ा एडजस्ट कर लेंगे तो हो सकता है सही हो। देखो हॉस्पिटल में खर्चा तो होता ही है, ये तो है नहीं कि फ्री कहीं का। वहाँ सरकारी में जाओगे तो वहाँ टाइम ज्यादा लगेगा या बेड नहीं मिलेगा, प्राइवेट में जाओगे तो 19-20 का फर्क आएगा, ऐसा नहीं क्योंकि जमीन आसमान का। फिर भी आप सलाह कर लो मुझे बता, ठीक है। थैंक यू। अच्छा,
There was some challenge with the video. In between, I think the video was stopping, है ना? So I hope you could see the difference in all 4 different styles of communication. I think one of the biggest learning that I want all of you to have from this program is assertive communication. Because most of the situations can be handled well if you understand assertive communication, you practice, and you excel on it. Any questions about whatever we have discussed till now?
I have one question, ma'am. So
Sure.
when we talk about assertive communication in a hospital, when the pressures are very high, I think I asked this question again and again probably, but when the pressures are very high and there's a lot of turmoil that is happening, is it is it really always possible for the doctors to keep their calm and to maintain and not get aggressive or passive? So for example, for passive aggressive situation also, I feel sometimes people go passive aggressive because they've seen that by being assertive or by talking about their situation to the right person, there is no solution that comes, and then it's like venting out as a passive aggressive thing. So
But does that help? Does that resolve the problem by being passive aggressive or aggressive?
depends. I mean, if the answer is to vent out and
No,
yeah.
that's not, we are not here to learn how to vent out. We are here to learn how to address the concern. See, you said in this stressful situation, I mean, is it really possible to stay calm? You must have seen some doctors who always appear very calm, whatever the situation is. Even in government setup, I've seen so many doctors who are so well behaved, very nice with patients. Not that their workload is less, but they are very professional in their conduct with their nurses, with their residents, with patients and their family members. And we have seen people, I mean, who would just throw their weight here and there and just show their aggression. So it is lot to do. One, of course, is with their personality. Second is with their training. Third is how they lead their own life. See, not to lose composure, I think we all need to create work-life balance where your mental health has to be on priority. If I'm in habit of becoming aggressive every now and then if this is how I behave at home and I don't care if I behave the same way at workplace, I will not work on myself. My mental health is going to go down the drain. So people who throw aggressive reactions at others, they are not peaceful in themselves. One is that they have to learn to look after themselves, work on their mental health, emotional health, how they handle situation. I mean, all people working in healthcare are not aggressive. So that means they are working on themselves. They look after themselves. Self-care is very important. Of course, training plays a very big role. If you had a senior who was very well behaved, you're likely to imbibe the same way of handling difficult situations. If you had a senior who was always aggressive or passive aggressive, you're more likely to, imbibe the same way of handling situations.
So, ma'am, these trainings, like the way we are receiving today, are these trainings a part of curriculum for doctors?
Now it is being made. Now they are realizing. See, recently, just 2-3 days ago, I was reading an article on suicide among doctors. It's rising so much that now they are getting alarmed. Problem is, we don't take this situation seriously till it actually crosses a limit, which is very sad. We are not proactive, we are reactive. Even if we are reactive and if we start taking it seriously and start working on it, nothing like it. Nothing like it. But we need to take some action. If we are not ready to take any action, if you are not ready to address it, then you can well imagine what's going to be. See, that is what has happened. Earlier, we kept throwing our anger at patient party. Today, they have become aggressive with us. That's the outcome of what they have received from us in the last couple of decades. Patients who used to literally, pray doctors as God, respect doctors like God. Today, kind of jokes they make and kind of comments they make is because we have forgotten how to behave in a professional manner. It's not just society's fault.
But ma'am, I think it's not just about behavior. Sometimes I think the aggression that patients have is also because sometimes there are doctors who are doing malpractices and who are not honest. And how much ever we might explain these behaviors to them, if they are doing malpractices, they're not honest, they will
Yeah,
not.
they are responsible for their actions. Everybody is responsible for their action. That's their call. If they are not ready to practice ethically, if they are not ready to let go of malpractice, then they may go scot-free, they may get caught. So it's their karma, and I don't think we can discuss that here. It's their call. If they are not realizing what is their role and responsibility, how they pay back in their karmas, we can't help it.
So, but what I understand from the sessions that we've had is that probably that change at policy level, that these the trainings that we are having, the kind of training that we are having today, should be a regular part of the curriculum for doctors.
I think that's also very important, and it's being done now. They have integrated it with the medical education system. They have introduced ATCOM module, attitude, ethics, and communication module in the medical education training right from year one. They are bringing changes, but then these changes will have real impact in almost a decade or two, not sooner than that. But then individually in our own capacity, can we behave more professionally, more responsibly? I think the idea of these session is not to talk about it at the policy or at the bigger level, but individually it is to empower people who are attending the program, and also how do you spread this at least in your own system wherever you are. That's the whole idea of this program. Thank you. That was a good question. I think, Michelle, you wish to say something. Go ahead.
Yeah, I had more of an observation. So throughout the entire length of, all that we've done today, I was looking at not just the patient and the medical professional, right? But like how in your videos you had that person in between, the nurse, right? So there's a lot of observation or a lot of like sandwiching that happens to the person who's kind of like the messenger who comes in between, right? So is there a possibility that, like how you said, like everybody's responsible for their own behaviors? In a way, you're actually modeling future behaviors, right? With the way you behave. So for example, if you continue to be passive, maybe that nurse would never come back and say, anyway, the doctor, I know what she's going to say. I'll only make the decision, get the discharge.
Absolutely.
Right. So
Sarana Vasi Praja.
yeah. So in a way, it it is kind of like more, I think, of awareness that everybody in the system needs to be aware that their communication makes a difference to either their own peers or their higher ups, or whichever hierarchy the system has. So I mean, for me, I think that was something that was very interesting, because from a behavioral or a observation point of view, I'm looking at it also about how people think it's only about skills, which is like me and patient's family, but it's not.
You are a role model to your subordinates, your colleagues, and people
Correct.
who are looking up to you for your good behavior. So whatever you behave, they are going to replicate or emulate.
Yeah, definitely. So
Absolutely. Thank you for that observation. Thank you. Anybody else who would like to ask or say something? So going further, okay. So I have a case study to discuss with all of you, and a small presentation on assertive communication, which will quickly flip through because we have discussed at length about the communication style. And then the same case study, I have a couple of questions to ask you. The questions that I have given you in the end of the case study or role play is to help you see the other person's perspective. Like when we started this session, we said patients don't cooperate, patients don't listen, they don't want to spend, they could be their hard of funds. Could be there's nobody to support them. Could be what are their challenges, we have no idea. Maybe they think they don't want to undergo amputation. They are more concerned about how will people see if we get the foot amputated. I mean, how will people look at my mother or my family member, or this person is physically, disabled or handicapped. So that was the reason why I asked those 4 or 5 questions. So I'm going to discuss that. But I wanted to ask, this time nobody opted for presentation. If you remember, I had requested that each session there has to be one presentation, and which you have to mutually decide. But nobody opted for the date. Let me remind all of you that presentation and minimum 8 session attendance is compulsory to claim your certificate. If you are not able to do it, then you'll have to wait for the next program whenever it happens, complete your formalities, and then you can ask for your certificate. So I'm sorry, but this is what is required. And especially if you're not doing the presentation turn by turn, then in the end, probably maybe you will have to stay up till 10:30. Because if you don't do it, one by one, then in the end, if all of you give together, then maybe we end the session at 11. So that's your call. I'm okay with that also. So okay, let me start with the presentation, which we'll just quickly go through, because I know we have discussed at length about the communication styles. Okay. So whenever we are in a situation where there's a disagreement. So it could be with the patient's family member, with our fellow colleagues. And as we have discussed, a lot of us become passive. In passive communication, we usually become quiet. We don't express our feelings. We put others, above us. We consider just 1 second. Okay. So they would, often apologize, even if it's not their fault. They'll say more sorry than actually expressing themselves. And they'll deny to disagree because they feel that if I disagree, it will create conflict. So in passive communication, we actually allow our rights to be violated because we are not expressing our honest feeling. And therefore, as a result, the agenda is to avoid conflicts, no matter what. So as a result, we are actually not able to share our honest, opinion, and we usually go with what others say. At the same time, we fear rejection, helplessness, frustration, and anger. Why? Because we have not been able to express ourselves honestly. There'll definitely be resentment as a result of it. And then self-respect. I mean, we don't respect ourselves, as I said earlier also, even others will not respect us for the same. So this is one situation, again, to show you the passive communication between a doctor and a nurse. The doctor is on round. The nurse is a passive communicator. So she says, doctor, the patient's sugar levels are high, maybe because she's with the patient for longer hours, so she's kind of reporting to him and telling him. So the doctor is aggressive in nature. So in a loud and irritated voice, they say, don't tell me what to do. I know how to manage my patient, just follow my orders. And that's what he expects. If the doctor is aggressive in nature, that's how normally they looks. Now, because she's a passive communicator, so now she feels, oh, I don't have to speak. So she just apologizes, oh, I'm sorry. I should have, spoken out of turn. And then after that, she does not offer any. So you can see if you are aggressive, your passive communicator, I mean, who is the receiver of your communication, will just shut down. They will go into their shell. They will not open. The other way that we have discussed is passive aggressive. And you can see from the picture, the person appears very calm and composed, but internally is very upset and frustrated. So you can see these people would not take any stand. They will not even take any responsibility. They also fear that I will be rejected if I assert it. There will be resentment because they are not happy with the situation. And they feel they are always, put to target and made to work more. And they also fear being confronted. Suppose if I expressed myself, or if somebody did not agree with me, then it can lead to conflict or, aggressive reaction. So these people, you will see, they are again not, exercising their rights, but they will, use manipulation and vengeance to equate. The goal here is also again to avoid conflict. And also then they want to make the other party feel that, oh, you did not ask me, you did not let me speak. If you had given me the chance, I could have fixed it. So they'll make you feel guilty that you were not fair to them. They also would behave passively on face, but later they'll go and talk, poorly about. You will also see them using sarcasm. So the second situation, now the doctor is aggressive, but the nurse is passive aggressive. Now in the same situation, the nurse says, doctor, the patient's sugars are high. Again, aggressive doctor says in a loud voice, don't tell me what to do. Now what she says, she puts a smile on face because she's passive aggressive communicator. So she's deceptive, she's acting deceptive. She's putting a smile on face and she's saying, okay, sorry, doctor. But then in her heart, she's saying, you fool, wait until my time comes. I'll make sure a patient complains about your incompetence. That means the other person is trying to sabotage you or to put you down. Passive aggressive people normally act in this manner. The third way of handling situation is active aggressive, where people actually become aggressive with others. So you will see that they will usually dominate in any kind of discussion and they will not let others speak or share their thoughts or feelings. The agenda is to win at all costs and to be always right. They will also try to protect their right and they will not care what do others feel or where others' rights go. They don't even consider the consequences of their actions. So a lot of time, because of their aggressive behavior, again they are at loss because others will not cooperate with them, or they may sabotage, or they may actually drift away. People would not like or enjoy working with such people. So these people, usually when they are communicating, you will see their eye contact will be very angry and intimidating, which shows that they are angry and upset. They will never defer to others. They'll just stick to their viewpoint and they'll believe what they're saying or doing is the right and the only way. You will see a lot of negative energy coming out of them in terms of, loud voice and belittling others. They'll often use violence or weapon abuse in their life. You'll see them acting very aggressive. Again, another scenario, rather the same scenario, but now the nurse is aggressive. In the same situation, in the same manner, she says that the patient sugars are high. Doctor is aggressive, so he behaves in an aggressive manner. And she responds by saying, excuse me, doctor, I'm also a part of the healthcare team. You have no right to talk to me the way you have done it just now. I'm going to file a complaint at the nursing officer against you. You can't talk to me like this. You will see how I'm going to fix you. So you will see, especially people who are, in the system for very long, and they are senior, and they feel that they have right to be aggressive, with others. So they may also respond with same amount of aggression. All these three ways of handling situation are not okay. I think we have discussed this earlier. The correct way is assertive communication. In assertive communication, we express openly, honestly, positively, confidently, and respectfully. So you will see people who communicate using assertion, they will protect their rights, but they will also not violate others' rights. They will respect others' rights. The goal is to communicate with respect and also to understand others' point of view. They'll try to find a solution to the problem and try for win-win so that both the parties are happy. So when they will communicate, they'll maintain eye contact, they'll present their wishes clearly and respectfully. Also, they will appear confident and strong, but they are flexible. They are not rigid to their point. Even while communicating, they are objective, and you can see that they have a good control on their emotions. As a result, they are not easily overwhelmed by the other person's behavior. They listen and validate others. So whatever right they receive from the other person, they are open to agreeing to that. So if you saw, I tried saying, Shika, I'm sorry if that happened with you. I'm sorry if there was a confusion or miscommunication. So even agreeing to, to the other's point of view, and especially if you think you have gone wrong from here, that's perfectly all right when you are discussing. So when you use this communication in your day-to-day interactions with your team members, with patients, even with your family members, actually there is no activity anger because you have expressed yourself in an honest manner. Relationship will improve because there is a transparency. There is no hidden feeling, hidden agenda, hidden emotion. Others will take your opinion seriously because you talk sense and also in the right, respectful manner. You earn respect and credibility because of the way you handle people and situations. There is a reduced risk of exploitation and abuse. Neither you are abusing their rights, nor they will try. They will not be able to exploit and abuse your rights. And life becomes easy and stress-free. So this is one slide I'll share with all of you in the group. It's an excellent slide. I want you to read it. So you will not only get to know about the behavior, but you will actually have a deeper understanding on their non-verbals, even beliefs that they have. Because usually what we do is the outcome of the belief we have about self, about others, and situations. The emotions in each situation we experience, and the agenda, and the goals that we have. But I'll share this. I'm not discussing this here because it's a long, slides, but it will be interesting to read the content. And in case if you want, we can always discuss it in the next class. So the same situation again, the nurse reports to the doctor that the sugars are high and we need to do something. So again, Dr. Rakesh is aggressive and he responds in the same manner. But this time, because the nurse is assertive, she says, I'm sorry if what I said looked like I'm questioning your ability. This isn't what I meant. It's only in the interest of the patient. I would like to know the plan of action for the high sugar. Again, aggressive. Now see, since she was not aggressive, the other person is now mirroring her behavior. And you will see this happening when you will apply this in your real life situation. He says, okay, start insulin. But remember, I'm the doctor here. You just need to follow my orders. And that's what is expected of you. Asha says, you're right. You certainly are the treating doctor. It's just that being a part of the healthcare team, I need to actively participate in patient care. So when you ask for your rights in a respectful manner, the other person is more likely to understand your point. So the whole idea is when you respect your needs and you also respect others' needs, that is in assertion in real sense. There are two parameters which if you can keep in mind when you are communicating, and that is you have consideration for others and high openness. You are assertive. So you should express what you feel. There is nothing wrong in expressing your honest feeling. But remember when what you are saying, you should consider how it is going to impact us. A lot of people in the name of being assertion, they become rude and blunt and they hurt others, and it damages the relationship. So that is not assertion, that is actually subtle aggression. Assertion is when you say what you want to say, but you are not aggressive. So this is in brief about assertive communication. I thought slides help you to have a deeper understanding of the concept. So any questions about the slides we have discussed? No question? Okay. So do we go ahead with the case study? The same case study. And I'm just going to ask you the questions. Do you want me to show the case study on the screen? Yes? Okay. Give me a second. Okay. So this is the case study where Mrs. Meena Sharma, 70-year-old woman admitted in the private hospital and with complications of diabetes. So the medical team has recommended immediate surgery to address a severe infection in her leg. However, her family was apprehensive and instead of discharging her are insisting on discharging the patient against medical advice to pursue traditional remedy. Now, my first question to all of you is, what could be the reason for the family refusing the treatment? I think each one of you can give one answer, but keep it very brief because we have 5 questions. And I want each one of you to think what could be the reason for the family to refuse treatment.
Might be the hospital is in suburb area and suburban area, and they think that facilities are not that up to date.
Absolutely. There's a possibility for this reason. Absolutely. What do others say?
Immediate surgery is being recommended by the team, the medical team. So when there is an immediate surgery, always they would have a second thought. Why are they immediately going for a surgery? So what are the reasons? So they need the explanation from the team, the honest explanation. Maybe that's
Absolutely,
the reason.
I think
Initially, so that they will explain better for them to take a decision.
so. That means if you're planning something big, you have to prepare them. You have to give them time. You have to give them time to process the whole thing. Unless it's something that is just life saying. For example, a patient has come in the emergency department. There you don't get that opportunity to prepare them. There you will have to come out honestly and openly. But then where there's a possibility, we should always prognosticate right in the beginning so that slowly they get prepared for that. Wonderful. Anybody else who would like to add to it?
Some family members came in and said that the treatment here seems to be too aggressive. It might be a good idea to root back to traditional therapies, which are not so
Absolutely.
aggressive.
So amputation itself is a very big decision. There's going to be complete lifestyle change of the patient. It can be a huge responsibility for the family also. And they are thinking that she's already 70 years. So maybe they would think that it's better if she stays like this. And a lot of time people even avoid any big procedure for this age group. Although things are changing now, not that like 70 years old are really that old and immobile, but then there's a possibility of that. There could be financial reason. They can't pay because it's a private hospital. The cost of surgery could be a lot. Maybe there's nobody at home to look after. There are 2 daughters married, living with their family. Who will look after the mother after the surgery? Who will keep her after surgery? Who will, get the further treatment and come for follow-up? Or even if she requires, prosthetics after the surgery, who will arrange all that? That also could be their reason, isn't it? Now you see, we are trying to get deeper understanding of the patient's concern. My next question is, what could be their challenges? What could be their challenges?
The same thing you said, ma'am. After the treatment, post surgery,
Yeah.
who will be with her, with their mother to assist her in her day to day, I mean, her own work. Maybe that could be their challenges, and they
Could be.
want the mother to live with the leg, however, I mean,
Yeah,
how
it's better if she lives like this. Yeah. Absolutely. So, what do you think is coming in the way of looking at the situation from your point of view? You have done your job well. You tried 5 days to treat the patient. You thought that maybe with medicine we can control the infection and we can, avoid amputation. But why are they not able to look at this situation from your point of
Lack of understanding of the disease and complications. Also, lack of update, as we discussed earlier, that the patient's
Yeah.
caregivers were not updated in time,
view?
or that prognostication was not done in early phase.
Absolutely. Absolutely. Maybe I use a lot of technical jargon. Maybe their health literacy or general literacy is low. Sometimes we have patients, coming just who are just not educated. So for them, this becomes a very big thing. They don't understand it. They have not seen anybody going through this. So that's something they have never heard of anybody having. Diabetes to kitne logo ko hoti hai? There are so many people in my family who have diabetes. None of them had this. Why amputation?
It can be empathy also, because maybe we did treatment as a part of the treatment only. Like we took it in a very monotonous way, the way we handle, and we were not at any point empathetic or concerned. And that was not, that can be one thing. We did everything right, but again, this didn't work here.
So it could be lack of rapport, lack of trust, lack of explanation, lack of understanding.
And also maybe lack of suggesting like a better processes will help her be independent rather
Yeah.
than just saying it's amputation.
Yeah.
Can also be one thing.
And also sometimes, if there's a belief that if we die, we should die with the complete body. And if you are losing a part of your body, next life you're going to be born with that missing that part of the body. So that's one of the reasons why people don't donate eyes post death.
Ma'am,
Even
is it also
Yeah.
sorry,
Yeah.
is it also possible that family dynamics could be a part of the decision making, right? If they aren't able to come together and make a cohesive decision and people are not there, or it could be caregiver related burden. One person is constantly pushed into the decision making role. That if obviously if patient autonomy is not there, then it makes it harder.
And a lot of time you must have seen the the new member who enters the scene comes with a different energy, different idea. I know somebody, I will get her treated there. Forget about this hospital. They are no good. I don't know why did you bring her here. You already knew that this is a useless hospital. Let us take her to that hospital. They have better arrangement. So that also sometimes, creates a barrier. So what strategy do you think will work in this case? I hope through the role play you got an idea that you need to,
Enhanced communication.
Listen.
yeah. Enhance communication, listen, yeah,
Build rapport.
build rapport,
And
address their concerns, like
Little
yeah,
empathy.
empathy.
and I think also little bit of like foreseeing what could happen, right? Because I think one of the things that even I took away was that 5 days it's been nobody
Yeah.
talked about amputation. Suddenly it's like in our face. So
So they should, and I think I did share with all of you a real life situation where the patient was patient had to undergo foot amputation. It was a group of anesthetists who were, I mean, this training was being done for them. And then one of them shared this experience. This patient had to undergo foot amputation. She came for PAC and she had no idea that I'm going to undergo. And we casually ask which part of the foot are they going to amputate. Foot amputation, I have never told them. Imagine, I mean, you have already planned something that you have not. So those kind of communications also, failures happen in our country. So I hope this whole discussion about the case study and then the role play and the PPT and the videos that we saw brings more clarity that we have to learn to address these situations. We can't run away from this situation. We should learn to handle them in a professional and a respectful. So what has been your learning from these, I mean, this whole discussion, video, role play, and case discussion? Quickly, one takeaway.
More and more trainings.
It requires a lot of training. Shikha, I completely agree. More you will try to, that's what I said, enjoy these role plays. Don't hesitate making mistakes because that is where we are going to learn. Nobody becomes perfect in the first go. But the more you will do it, more apt you will become.
Yes. For the trainer, these role plays are very important as a trainer.
Absolutely.
That how you can be into the show of one another.
Absolutely.
And then you can understand the things.
Shikha, you have brought in a very, very important thing. A lot of time when there's a very difficult situation and the participants have not been able to, showcase the expected skills and behavior, they ask me, you do it. Man, aap dikhao, aap kaise karo. So if I'm not able to demonstrate or showcase, they will lose faith in my work. Because she's just teaching, but she herself cannot handle it. So
they said that all these things are all words. Practically,
yeah.
this is something different.
Exactly. So you really have to be very, very thorough with your content and also practice. I mean, a lot of time they will give you a situation that you have not thought of. Your participant will give you a situation, ma'am, this thing happened. Tell us how will you do that? How will you handle this? So you will have to immediately come up with, and I will be giving you those situations in the coming session, where they gave me situations which were not like as per the plan, but then you have to be really good at quickly designing how you're going to handle. And the more you will learn and practice, more confident you will be in real life situations also.
Yes.
That's the beauty of the session, that it's not just for your workplace, even in your personal life, you learn how to communicate.
Where you have to keep silence.
Absolutely. So with this, we come to the end of the session. It's 10 o'clock. I'm sharing a feedback form. I request all of you to complete the feedback before we leave. Any questions? I'm open to answering. Please, you can ask.
Ma'am, only one question.
Sure.
During our trainings, who must be our target audience? The junior ones or the senior, the top management?
Shikha, to start with, practice your hand at juniors because they are more receptive. They are less likely to trouble you because see, ultimately you have to learn to handle difficult people also. So it is better if you start with from simple to complex. More senior people are more likely they are to question you, to refute you, to make you, to shake your confidence.
With my less experience, I found that juniors are more, they are not accepting the things. Why you have been taught all these things? We know everything. We don't require these things.
So that means you have to have the content that they do not know or they have.
Earlier also I asked the same question and got the response in the same way.
I made you do role play. I made Michelle do the role play. Though she's into counseling, and I'm sure in counseling we do a lot of these things, introduce yourself, ask their introduction, make them talk. And Michelle was doing all that very well. But what exactly I wanted her to do, She couldn't do because she didn't know that this is how I have to handle the situation. And I'm sure this must have been a good learning experience for her, where I brought her and everybody's attention to the point. Ask, why do you want to go? Where do you want to go? What are your concerns? I want to help you. Tell me, how can I help you? Change the complete, quality of interaction, where you say, I am with you. I'm not an opposite party. We are same. We are one party. I want your benefit. But then you have to be 10 steps ahead of your audience.
And rather than saying what, I should use why first.
I never asked you, what have we not done? We have done everything. I have updated you. I have always informed you. You can see, I never argued, never countered your claims. You were constantly making claims. Nobody heard me. Yesterday, you never brought it up. I gave you a reason. I said, we don't ask our juniors to talk about such a big thing with the patient party directly. It's usually the senior person who talks. I gave you the reason. So, see, the more you will do, more. I have had the same share of problems when I started with the government sector, but that I did not take it as a challenge, but I took it as an opportunity to learn how to answer these questions. They will ask you, why should we learn this? We are already doing so much. Do you think we are doing less? Especially in government sector, they are already, especially those who are working very hard and they are short of staff. Can you mute your device, please? Yeah. So they will have these things, but then when you explain them how are they going to be benefited individually, they will be ready to listen to you. Plus, you have to have patience. You need to stay calm. If you lose your composure and you start arguing with it, अरे नहीं करना मत करो जाओ ना. I'm not asking you to sit here. Go. If you don't want to attend, are you obliging me by sitting here? I can't talk like this. I have to stay professional. So it is purification by doing. You evolve by doing. No? I hope I have answered your question. Okay, so please go ahead and complete the feedback form.
I've completed it, ma'am. Just one, not a question. I just wanted to share a thought, a takeaway that I have from today's discussion. That I think if we are clear about the goal of the interaction, it will help us keep ourselves assertive.
The goal is two things.
Yeah.
What are those two things?
Patient welfare.
Okay.
I mean, that's one. That the well-being of the patient. And second is, okay, sure.
See, the whole idea is openness and consideration for others. When you have these two things in mind, of course, it's all in the patient's interest. But I'm not going to thrust my opinion on anybody. I have the right to express myself. But I can't say, no, I will not allow you to take. More than that, normally people say, le jao. Why do I care? You can take. Even that's not right way. Make an effort to help them understand how is that going to, be damaging. And then you give them the choice. So in the end, my last word to Mitu was, go home, discuss with your family. If you still come back and say that we want to take, my team will cooperate with you and will help you shift the patient. And that's where my discussion ends. And I disconnect myself from the situation. And I don't take it personally. I don't feel bad about it. Or they didn't agree with me, they didn't listen. And even if they come back and they say, Dekha, I told you you have to come back. Now you have come back. I will not take care of you. I've seen doctors doing that. But we can't do that. So I've received 4 responses, I think 1 more, 2 more. I think Dr. Pradeep will not be able to respond because he said that he will be in the OT, which is okay. Who is left? Oh, Dr. Pradeep is there. So were you listening to us or you were occupied with your work? Dr. Pradeep, could you really listen?
But I have heard the whole communication. No. I was listening to. It was basically a role play. And,
So I'm not able to hear you. Maybe you are not in a good network area. That's why I'm not able to hear you, but I can see your picture. I'm glad that you attended the program and I request you to watch the video. Then probably you will.
I can summarize.
I'm not able to hear you. So whatever questions you have, Dr. Pradeep, I'm not able to hear you. So I think we'll end the session here. Thank you so much. Let's meet next Wednesday.
Thank you so much.
Good night.
Thank you, ma'am.
Good night, everyone.
Good night. Bye-bye.
Thank you.